As I guess many of us in the field are aware of, there are many studies out there that try to understand modifiable risk factors for dementia, but most of these really only look at one or a limited number of risk factors, which typically reflect cardiovascular conditions or related lifestyle behaviours like physical inactivity. Whereas there have been epidemiological studies that have suggested that, many adults have multiple simultaneous modifiable risk factors. So what we try to do is try to look at a larger range of risk factors across multiple domains of life. And we wanted to look at how these risk factors were related to cognition in a middle-aged cohort. And we hope that this would help us get a bit more of an accurate estimate or even more of a complete estimate of individuals' modifiable dementia risk very early on when, people are still cognitively normal. They've got no frank cognitive impairment, but they may, the very early subtle pathological changes may start to be occurring at that stage. So I am very fortunate to be working with data from the Healthy Brain Project. This is an online remote assessment study that seeks to understand midlife risk factors for dementia. So it's an Australia-wide study, so everyone can just join up online, and they do a bunch of self-report online questionnaires on their health and their lifestyle. They complete the Cog State Brief Battery in order to measure cognition. And we also send out a saliva kit to them so that we can get a genetic sample as well. So I looked at data from this study in order to answer the question, how prevalent are these modifiable dementia risk factors across different areas of life in this group of middle-aged adults, and to what extent do these risk factors co-occur? And then how does this relate to cognition? So we found that, what we expected is that, many of our participants had risk across multiple domains. So firstly, about 93% of participants had at least one modifiable dementia risk factor. They reported at least one modifiable dementia risk factor, suggesting that almost everybody had some risk. 67% of our participants had at least one modifiable dementia risk factor in two or more of our domains. And the domains that we looked at were mood symptomatology, lifestyle behaviours, cardiovascular conditions, cognitive and social engagement, and sleep disorders and symptomatology. So the majority of participants had risk across two or more of these different domains. And then, so once we saw this, we wanted to, understand, well, how is this related to cognition? And so we observed that compared to participants who had zero modifiable dementia risk factors, those who reported risk in 3 to 5 of these domains had worse memory performance and greater concerns about their own cognition or their own memory and thinking. And this difference, the magnitude of this difference ranged from about moderate to large. And so these results mean that, in a middle-aged cohort, we observed that multi-domain modifiable dementia risk factors were highly prevalent and associated with cognition, worse cognition. So this could mean that, this high burden of modifiable dementia risk, particularly across different areas of life, may be related to very early subtle negative neurological changes. However, future research will be needed to determine this. I think what this work supports is that modifiable dementia risk is multidimensional. People have risk across multiple areas of their life. So this will really be important in dementia risk reduction and prevention guidelines to consider. It may not be enough to advise somebody to just increase their physical activity when their risk really is, more related to their sleep or their mood or something like that. So it's likely a lot more complex than, we would like. And I think, in this work, we try to focus on risk factors that are, quite practical to target and to modify, such as, physical activity, cognitive and social engagement, rather than risk factors like air pollution, which might be a lot more complicated and difficult to modify. But in saying that, there are also barriers to modifying these risk factors, such as access to healthcare and education around these risk factors as well. Health literacy around dementia, modifiable dementia risk is quite low. We see in studies. So we really need to, make sure that people have the knowledge as well as the facilities and the capacity to be able to modify these risk factors to reduce their dementia risk.